Welcome back to Hemorrhagic Flu Watch. I'm Morgan Vance.
And I'm Dr. Hannah Rice with the Centers for Disease Control.
Back with your weekly update on the epidemic that's sweeping the United States. Here's a recap for those in the audience who are just joining us for the first time this week. 4 months ago, the first case of hemorrhagic flu was diagnosed in New York on July 23, 2018. Since then, hemorrhagic flu has swept across the United States in an unprecedented amount of time. About 50% of the United States population has died because of this disease. It has also found its way into Canada, Mexico, the United Kingdom, and much of Africa. Dr. Rice has been so kind to join me in this weekly podcast to keep you updated on the hemorrhagic flu crisis in the United States. The CDC has had a breakthrough in research this week, so we're going to spend a lot of time in this episode telling you what they've learned about the hemorrhagic flu so far. Now, Dr. Rice, can you explain a little bit about what this hemorrhagic flu is?
Of course. So, hemorrhagic flu is a virus that is descendant of the H1N1 influenza virus that circulated in the U.S. last year, and the Ebola virus that has had such a devastating effect in Africa the past
So you're telling me that this disease is a combination of diseases that we've already seen? How can that even happen?
So here's a little virology for you.
Okay.
When viruses attack the same cells, they're able to transfer some of their genetic material to each other. Now this is a completely normal route of mutation within the same virus family, like the H1N1 flu virus and say the H3N1 flu virus. But transfer of genetic material from one virus to a completely different virus, like we're seeing with H1N1 and Ebola, has never happened until now.
Okay, that makes a little more sense. So besides the fact that the new virus is a combination of the two, what makes it so deadly and why is it spreading so fast?
Well, when the Ebola virus mutated with the new influenza DNA, it gave the Ebola virus a new attachment protein for respiratory tissue.
Okay, so in normal words, that means what?
Well, it means that the new virus is airborne and not just transferred by bodily fluids. So it has multiple vectors of transmission now, and it spreads faster through the open air. It's also spreading so fast because it's a virus and the antibiotics won't do anything to treat it. And we also have no vaccines that protect against it.
So how is the CDC trying to combat the hemorrhagic flu? What kind of research are they actually doing?
Well, we've done a lot of work growing it in the lab and studying its structure on a microscopic level. Like I said, we've already learned there are new proteins involved in attachment, and we've already figured out that it's a mutation of the H1N1 flu strain and the Ebola virus.
Okay.
So we even think we've determined the index patient, which will help us track how the disease started spreading so we can prevent future spreading. And of course, we're also working on a vaccine.
What do you mean index patient? You mean you know where the virus actually came from?
Well, the index patient is the first patient to have gotten the disease and basically started the epidemic. So yes, we know where it came from. We can trace the spread of the epidemic backwards and kind of map the geographic spread of the disease to find out where it came from. And these methods have been used for a long time, starting with the big cholera epidemic in London in the 1800s.
Okay, so where did it come from?
I can't release a lot of personal information, and a lot of it's confidential to researchers at the CDC. But I have traced the virus to one patient that visited Congo while having flu-like symptoms. And we can only assume this person had the H1N1 strain and came into contact with the Ebola virus while they were in Congo.
So what kinds of symptoms should people look out for?
Hemorrhagic flu, unfortunately, has many of the same symptoms as Ebola and the flu. So the first few symptoms would be fever, weakness, headache, fatigue, and muscle aches. Once the infection starts to progress, though, you start getting the worst symptoms that everyone's afraid of, like vomiting, stomach pain, the unexplained bleeding from the eyes and the ears and the nose, or even internal bleeding that looks like bruising.
Wow, that sounds brutal. For our viewers at home, or our listeners, what do you think they could do if they have, or even suspect having the flu?
So the CDC has set up a hotline connected to the local police department. If you think you or someone nearby has hemorrhagic flu, please call 311 and you'll be routed to the nearest emergency room where an ambulance will be dispatched to your location. Remember that under Title 5.2 of the Emergency Medical Procedures Bill, that anyone who has knowledge of a hemorrhagic flu case who does not report to 311 is subject to persecution. This is a matter of public safety, and we all need to do our part to keep other people safe.
Agreed. What about the people that are at risk, though? So basically everyone in the United States. How can we keep from catching this virus?
Well, people should stay away from crowded areas, but if you have to go out in public or you have to go out in a crowded area, please wear a medical face mask. That will keep the virus from spreading through the air and from you inhaling the viral particles. Also, if you suspect someone has hemorrhagic flu, don't get into close contact with them, but please do report to 311 so we can put them in quarantine to protect you and everyone else from getting sick.
Now we have some questions from our viewers or listeners that haven't been covered yet. Our first question is from Robin Clark from Mulberry, Indiana. She asks, does hemorrhagic flu always kill? My sister's being quarantined and wasn't doing well when they picked her up. Is she going to die?
So hemorrhagic flu is highly contagious, and it has a fatality rate that's running right around 60%. Even though that's a very high number, it's also important to keep in mind that that means 1 in 3 people who contract the virus will recover, and we hope that your sister will be one of those 1 in 3.
Thank you for your question, Robin. We're sorry to hear about your family being affected personally by the hemorrhagic flu crisis, and we hope your sister is feeling better soon. Our second question is from Maya in Austin, Nevada. She asks, is it possible to spread hemorrhagic flu virus through sex? I've been dating this guy for some time and we've recently started being sexually intimate. He was diagnosed with hemorrhagic flu yesterday. Should I be concerned that I might get it too?
Unfortunately, yes, the hemorrhagic flu virus can be spread through sexual contact since it can spread via bodily fluids. Maya, if you start having any hemorrhagic flu symptoms, call 311 immediately. And the sooner you start getting treatment, the better your chances of recovery.
And our last question is from Andrew Byers from Martin, North Dakota. He asks, how is hemorrhagic flu treated? My 6-year-old son has it and is in quarantine right now. The doctors have been so busy with all the other patients that we know next to nothing about our son's treatment. What are they actually doing to help him? I'm so sorry to hear about your son, Andrew. I'm sure the doctors are doing everything they can. We already talked about how there's no cure for hemorrhagic flu right now. So what are they actually doing for the patients, Dr. Rice?
Well, like you said, we can't cure it, but what we can do is treat the symptoms. So patients are usually put on IV fluids and provided medications to manage the stomach pain, vomiting, headaches. Some doctors have also reported that they're trying drug therapies to help with blood clotting to try and stop the unexplained bleeding. Like Morgan said, Andrew, I'm sure the doctors are doing all they can, and I hope your son has a full recovery.
And that brings us to the end of this week's podcast. We hope this week's episode has helped shine some light on this dark epidemic and will help you all stay healthy and hemorrhagic flu free. We will be back next week with more updates on the hemorrhagic flu crisis. This is Morgan Vance
And Dr. Hannah Rice.
signing off.